Here is your stem.
Could I know her name as a
Okay,
consultant?
you can call her Samantha
Mm,
or whatever name you want to give her. It's freedom.
Okay, okay, and the consultant.
Mr. Mann,
Okay, I will start.
both are ready?
Yes, I'm ready.
Okay, so if you've read and understood, considering it communication skills station, please begin.
Hello, I'm Dr. Mahmoud, surgical house officer, working for Mr. Mann in Cook Hospital. I'm calling to speak the vascular consultant. Could I confirm that I'm speaking to the vascular consultant?
Yes, can you summarize your case?
Okay, sir. I have this patient aged 54 years old with mild diverticulitis. She was improving with IV antibiotics, but suddenly she complained from right lower limb pain. On examination, her right limb was pulseless and pale, and pain is not responding to paracetamol. Her investigation showed metabolic acidosis and hypokalemia. Her ECG showed atrial fibrillation. Uh, has I did her an arterial duplex, which showed acute ischemia. I suspect she has critical limb ischemia, and I would transfer her to you for a definitive treatment.
Okay, and do you think is it urgent, or can we send it tomorrow morning instead?
Yes, sir. I think it is very urgent. The patient has critical limb ischemia, so early intervention was be really needed for avoiding losing the limb.
Why do you suspect acute limb ischemia?
Clinically, the patient is pulseless and pallor and has been irrational to and has been that non-respond to analgesic, and her ECG shown atrial fibrillation with increase the risk of emboli and vascular occlusion, and also the arterial duplex confirms the diagnosis.
Okay, do you need a cardiologist review for premature ventricular complexes before transfer?
Maybe later, sir, but for now, no. I just want to transfer her because the time is critical.
Okay, what do you think is the cause of arrhythmia in this case?
I think the hypokalemia is the main cause of arrhythmia.
And when was the ECG taken or done? Do you know that?
Um, Actually, I will check for that. We did it. I will check for that.
Okay. When did you find the absent pulse?
Absent pulse. Uh, I will check for this too, sir.
Okay. And what do you think of our presumed diagnosis of diverticulitis?
Uh, for now, it's a view of acute limb ischemia and AF. I will, if I have to consider the presence of mesenteric ischemia as well, because atrial fibrillation and the abdominal pain.
Okay. And what is your differential diagnosis?
Mesenteric ischemia, inferior MI, mesenteric ischemia, perforated viscous, and infective colitis.
do you want to scan the abdomen first for diverticulitis?
We will need to scan her abdomen, of course, but I think after the transfer.
And could it be mesenteric ischemia anyway?
Yes, it could be, as the patient has atrial fibrillation, but for now the abdomen is soft and lax. I will do serial abdominal examination if needed. We might also do CT angio, but after management of the leg.
What other imaging you want to do?
CT angio for planning for the surgery.
And how to transfer this patient? What
Air
will you prepare
ambulance.
before transferring?
Okay, if I transfer her with the ambulance, I will confirm the presence of CBRSS and syringe pump with cardioversion drug like amiodarone.
And what is your management plan?
This is a critical ill patient. I will management her according to airway, breathing, circulation, deformity, and exposure approach. I will confirm the airway is patent and the breathing is normal and she is taking her breath normally, and will examine the touch and those calpages chest, and I will deliver two white book cannulas and confirm her blood pressure.
Okay, what
And
other than that, what
the-
you want to do?
I will then correct the hypokalemia and correct the AF, and giving her anticoagulant. Of course, this is a crucial in the corner store in managing this case until embolectomy and the correction of the metabolic acidosis.
Okay, great. And what is the definitive management of this
Either
patient?
either embolectomy or angioplasty, thrombolysis, or bypass surgery.
What else? What else you can do?
If she had compartmental syndrome, I will no, I will do fasciotomy because I'm afraid of compartmental syndrome and the fear of reperfusion syndrome.
What is reperfusion injury?
Reperfusion is when the limb gets vascularized after a period of ischemia. This causes the metabolic toxins to be absorbed from the circulation.
And how will you manage atrial fibrillation?
I will correct the metabolic acidosis. I will give antiversion like amiodarone. I will also give anticoagulant.
And how to correct hypokalemia?
By potassium chloride, 20 milligram in 1 liter normal saline, under close monitoring with ECG and the serial potassium level measurement.
Yes.
Continue, please.
What to anticoagulate with this patient?
Ultra-fractionated with heparin, 80 international unit, or low molecular weight heparin, low molecular weight heparin.
What will you tell her family?
I will skip this question for now.
Sorry, you want to pass this question?
No, I will tell them that she need a vascular surgery and we have to transfer it. To transfer her.
Okay, and what is the early sign of ischemia?
The earliest sign is pain out of proportion to the movement due to nerve ischemia.
Where does the pain come from?
Come from nerve ischemia.
And what does a positive 2-point discrimination test tell you?
That the limb is viable.
And what is the cause of limb ischemia in this patient?
The emboli.
The risk factors?
The risk factor, the elderly and the atherosclerosis and the hypertension.
And okay, that's the end of the session. End of my question.
Okay,
Okay,
thank you
now
so much. Thank you.